Hello, everyone. My name is Kaya Verich, and I am excited to welcome you here tonight for our fourth and final week of the 2025 Thrive Series. As I said, my name is Kaya Verich, and I'm a nurse clinician at mHealth Fairview working in the Cancer Survivorship Program. And I'm co-hosting today with Liz Danley, the Survivorship Events Coordinator at the Masonic Cancer Center. On the behalf of the Thrive Planning Team, we are so excited to welcome you here today to our final session of the Fall 2025 series. Before you begin, we do have just a couple of quick notes. Please stay muted during the presentation and use the chat box for comments and questions. This session has been pre-recorded by both of our presenters. Therefore, we will not have a live Q&A following the presentation, but we do encourage you to jot those questions down during the presentation, take note of them, and then to take them back and discuss with your provider. If you are a UMN employee or spouse participating in the Employee Wellbeing Program, we'll share a link in the chat that will record your attendance and earn your wellbeing points. So tonight, we're excited to share, again, a pre-recorded session from Dr. Tara Rick. Dr. Rick is a research associate in the Cancer Survivorship Program at the University of Minnesota and is a member of the Screening, Prevention, Etiology, and Cancer Survivorship Program within the Masonic Cancer Center. She is also a practitioner, or the practitioner, at the mHealth Fairview Cancer Survivorship Clinic, where she sees and cares for patients that are greater than 5 years out from their cancer treatment and talks with them about long-term cancer survivorship. Tonight, she'll be talking with us about survivorship guidelines, living well with and through cancer. Following Dr. Rick, we'll also be hearing from Tom Butina from Pfizer, This is Living with Cancer program. Tom is the Director of Oncology Patient Solutions and Alliances Marketing at Pfizer and serves as the U.S. commercial lead for the This is Living with Cancer, among a variety of other initiatives. With that, I just want to welcome both our presenters and then, of course, all of you for joining us tonight. Liz will be hitting the play button. So again, just to let y'all know, these are pre-recorded questions. We will not have a Q&A following, but please feel free to jot those questions down, and or the comment section will be open if there is some group comment or thought that you'd like to participate in. So with that, thank you all. Liz, I will hand it over to you.
Hello, everyone. My name is Tara Rick, and I'm a longtime oncology PA or physician associate. Over the past several years, my clinical and research focus has been specifically on cancer survivorship. Tonight, I'll be talking about the NCCN guidelines for cancer survivorship, which serve as an evidence-based roadmap to guide how we care for individuals during and after cancer treatment. These guidelines cover core components such as surveillance for recurrence, management of late effects, coordination of care, psychosocial support, and health promotion. And while many of these aspects of survivorship care are really individualized, it really depends on what your cancer type is and what specific treatment regimen you received. One essential and universal element of cancer survivorship guidelines is lifestyle modification. Lifestyle behaviors play a powerful role in reducing the risk of recurrence, managing long-term effects, and preventing secondary cancers. If you joined the Thrive series 2 weeks ago, you heard from Dr. Robert Tureski, who spoke about environmental exposures that can increase cancer risk. Tonight, we're building on that foundation by focusing on what's evidence-based and within our control for those of us who have already had cancer. What are the things that we can do to reduce our risk after cancer? This session also stands alone, so it's relevant to anybody who might be watching this recording later. And just a quick note, I'm a healthcare provider, but I'm probably not your healthcare provider. So this talk is meant to provide general high-level guidance, not individual medical advice. So I encourage you to pause, grab a pen and paper, and jot down questions as we go. Things to discuss with your own healthcare team, who can tailor recommendations based on your specific personal situation. Many of you have likely heard about lifestyle changes before, but you still might be wondering how to practically apply them in your own life. Or maybe there's just a lot of noise out there and you're wondering what is evidence-based and what's not. And I know you're motivated because you're here. So I've also included several resources and tools that might help you take the next steps if that's where you're at. Finally, this talk is pre-recorded for scheduling reasons, but please keep the chat active. If you have tips, experiences, or resources that have helped you, please share them. Your insights might be exactly what somebody else needs to hear tonight. Hello. So why do we have guidelines for cancer survivors? Well, cancer survivors make up a large population. There are over 18 million cancer survivors in the US, and that is over 5% of the population. We know from the literature that a large proportion of cancer survivors experience things like weight gain, muscle loss, reduced exercise capacity, and other health problems. And we also know that overall, cancer survivors tend to use primary care or see their primary care provider less. This matters because weight gain and inactivity are strongly linked to poor outcomes, such as decline in function, increased risk of chronic health problems, lower quality of life, cancer recurrence, and even increased risk of death. On the other hand, there's compelling evidence showing that lifestyle modifications, like regular physical activity, weight management, and healthy nutrition, can improve or even treat many of the most common survivorship concerns, such as anxiety and depression, chemo brain, fatigue and pain, hormonal and sexual health symptoms, and sleep disturbances. And there are more as well. And these same behaviors have also been shown to reduce the risk of recurrence and death in several cancer types. Of course, achieving these goals can be challenging, especially after cancer treatment. I hear this a lot from the patients that I see. But it's important to remember that small steps matter. Even modest weight loss in those who are overweight or slight increases in physical activity in those who are sedentary can have meaningful benefits for both cancer-related outcomes and overall health. The National Comprehensive Cancer Network, or the NCCN, has created a 300-page document establishing a framework for coordinating survivorship care across disciplines and settings. It covers a lot of things. It covers surveillance for recurrence and also new cancers, management of late and long-term effects like cardiotoxicity, damage to the heart, neuropathy, endocrine problems related to cancer treatment. It also talks about coordination of care between different healthcare providers, like your oncologist, your primary care, and specialists. It talks about psychosocial support, how to manage distress, depression, coping, social needs. And it talks about health promotion and lifestyle interventions. And why I bring this up, this is not, this large document is not anything that you need to go and read, but your healthcare providers can go and look up the guidelines. And what is new in the 2025 update is a sharpened focus on the importance of physical activity, nutrition, and weight management as integral evidence-based components, not optional additions. There is a stronger emphasis on structured behavioral change support, like they've added that health coaching is something that can be utilized. They talk about referral mechanisms to different places to help support cancer survivors. They've enhanced alignment with other oncology and preventative guidelines to support integration. So because of this new guideline, we are talking about this today. So this slide is an overview about the general principles of healthy lifestyles in the NCCN guidelines. And the update highlights that healthy habits not only improve quality of life, but also reduces the risk of recurrence and mortality. According to the NCCN and the other evidence-based guidelines, cancer survivors should aim to do the following: maintain a healthy weight, avoid inactivity, exercise, eat a plant-forward diet, limit red and processed meats, added sugars and sweetened beverages, and limit or avoid alcohol. And we'll talk about all of these more in detail later. But other things that I just want to mention that are on the list are also avoid tobacco in all forms, and then practice sun safety. And for those who don't know, what are they referring to? That is basically wearing sunscreen on a regular basis, SPF of 30 or greater, replying every 2 hours after swimming or sweating, and then using physical barriers like hats, long sleeves, or shade, especially when you're in the peak sunlight hours. And then avoiding tanning beds and sunburns as much as possible. And then sleep, the recommendations for adults is to really try to prioritize getting 7 to 9 hours of sleep at night, which we know can be challenging when sometimes we can't always control this. But these lifestyle behaviors form the foundation of survivorship health, supporting our energy, mood, immune function, and long-term outcomes. A successful survivorship plan requires a team-based approach to address barriers and support lasting behavioral change. Survivors benefit the most when their care involves a collaborative team, which could include, of course, your oncologist and your oncology team, like the advanced practice providers, your nurse care coordinators, your primary care provider, which is super important for everybody. We'll talk about this in a minute. But depending on your needs, you may really need to rely on some other providers, like physical and occupational therapist to address mobility, strength, and function, registered dietitians for individualized nutrition guidance. You might need social work or patient navigators to help support your psychosocial needs and your practical needs. You might need certified exercise professionals and health coaches, which this is new in the guidelines this year, recognizing how important it is to help build and maintain healthy habits. Tobacco treatment specialists if you need help with cessation. But then also care should extend beyond the clinic. There are a lot of resources with community-based programs that can reinforce physical and emotional well-being. And a lot of times community-based organizations are free or low cost, which don't add to financial toxicity. Now back to primary care providers. I know from my own clinical experience, and we know from the research, that cancer survivors don't utilize primary care as much as the guidelines recommend. And I know that when you're on active treatment, it feels like you're in the oncology office all the time and that your oncology team feels like they're your primary care providers, but that isn't the case. There are different focuses of the care from oncology and your primary care provider. And it is really, really important to see your primary care for routine health maintenance. What are the other cancer screenings that you need, or the other screenings for chronic health conditions, vaccinations, and other chronic disease prevention. The biggest barrier that I hear in my clinic over the last 20 years is that patients can't find a good primary care provider, or primary care clinics aren't taking new patients. In my opinion, I think a primary care provider or clinic close to your home is important. It needs to be convenient. I also think word of mouth is a great way to find a good primary care provider. Ask your family, friends, other cancer survivors who they see. Ask your oncology team who they see or who they recommend that you see. So I want to take a minute here just to explain what are health coaches, because I don't know about you, but I didn't know what health coaches was when I read these guidelines. So I've taken it upon myself over the past year to educate myself. But what health coaches are trained behavioral change professionals who use goal setting, motivational interviewing, and accountability to help survivors or anybody implement provider recommendations. So specifically, this could be activity, nutrition, stress, sleep kind of behavioral changes in daily life, bridging the gap between clinic and the home. So where they fit, so they would complement oncology or primary care. So they'd be an addition. They could coordinate with what your PTOT recommends. They can enhance what your, the implementation of what your dietitian recommends. Social work, they can escalate to let you know when you should let your clinician know if there are some red flag symptoms, perhaps some emotional or mental health things that you should bring to your provider's attention. And then I just wanted to mention that this is evidence-based. There was a randomized controlled trial with over 3,000 breast cancer patients, and the patients who received telephone health coaching received weight loss at 12 months post-treatment versus weight gain in the controls, because weight gain is really common after breast cancer treatment. They also increase their activity levels over a year-long period, demonstrating scalable and sustainable impact in survivors. Access and coverage is an issue since this is sort of a new concept. Insurance coverage is still limited. This is improving. Some employers are paying for this benefit for their employees. There are some digital programs, and some clinics are actually offering this for their patients. And I've actually seen a few insurance companies as well. But options include self-pay, HSA, FSA, or other programs to help pay for this. For survivors who continue to smoke, we know that quitting tobacco is one of the most powerful things that you can do to reduce your risk of recurrence, prevent second cancers, and enhance survival and quality of life. The NCCN recommends evidence-based cessation support, and there's really two things that the literature have supported that are the most important components of a program for smoking cessation. And that is number one, using behavioral counseling and medications. And this could include nicotine replacement therapy or other medications like bupropion to help with smoking cessation. And then I've put some resources here that offer both of these components. All right, let's get into the meat and potatoes of this talk. Exercise. I always hope that one of the major takeaways from a clinic visit with me, a cancer survivorship visit with me, is understanding how important exercise is. It is safe, tolerable, and effective for nearly all cancer survivors, regardless of age, stage, or treatment type, with appropriate modifications. Some of the demonstrated benefits include improved cardiorespiratory fitness and muscle strength, improved energy levels, less fatigue, improved balance, mobility, and just daily functioning, improvement in mood, anxiety, and overall feeling of quality of life. It improves sexual functioning and body image. It also supports weight management, metabolic health, and very important for a lot of people, it reduces the risk of recurrence and mortality in several cancers. program should really be individualized and supervised when needed. Some people need a little bit more help than others, and we have programs like cancer rehabilitation programs to get you started. So I just wanted to show you a little research that supports what I'm telling you, so you don't have to take my word for it. So this particular large systematic review looked at 80 meta-analyses covering the benefits of exercise and cancer-related outcomes. So they looked at over 400 studies, and they found that over half of them had statistically significant um, outcomes showing the benefit of exercise. So therefore, we consider this high certainty exercise. And what were the outcomes that these studies showed? They showed an improvement in well-being, sleep, mental health, physical function, but also mitigating treatment-related effects. So reducing the risk of cardiotoxicity, improving neuropathy, and improving chemo brain. So this is really some of the data that helps reinforce that exercise should be integrated into survivorship care protocols. Why do we care about cardiovascular disease? I thought this was a cancer-related talk. Well, we know that in this country, the number one cause of death is heart disease, and there is no exception for cancer survivors. If you look at numbers overall, this is the leading cause of death. And the risk of cardiovascular disease increases with certain treatments, like a history of chemotherapy and radiation, especially if radiation was near the chest. So regular aerobic and resistant exercise improves cardiac function and the health of your vessels, your vascular health. It improves your blood pressure, your cholesterol, your insulin sensitivity. It helps mitigate treatment-related cardiotoxicity. So observational data and meta-analyses show that there is about a 20 to 30% reduction in major cardiovascular events and death among physically active cancer survivors. So the bottom line is exercise functions also as a cardioprotective intervention, and again, as an essential component of cancer survivorship care. I wanted to show you this study. This is a landmark analysis of 1,000 adult survivors of childhood Hodgkin's lymphoma that found that engaging in what translates to 3 hours of, say, brisk biking weekly was associated with a 51% lower risk of major cardiovascular events compared to those who were inactive. 51%. So the study also showed that this was a dose-response relationship. So like a little bit of exercise had a little bit of benefit. And then this is sort of where they came up with some of these goal levels of exercise as well, which we'll talk about. So we've talked about how exercise is proven to make cancer survivors feel better and reduce the risk of heart disease. But what if I told you that exercise would reduce your risk of cancer recurrence and death too? Would you believe me? Would you believe that something that you can do, that you have power over, can have that kind of impact on your life? So regular physical activity has been shown to reduce recurrence and mortality across many cancer types, and I listed them here. It is truly one of the most effective evidence-based treatments that we can prescribe in survivorship. It's a therapy with no copay and countless benefits. If you've been following this fall's Thrive series, you've already seen this paper, but it is such an important paper that I wanted to highlight it again. This important study showed that regular structured exercise after finishing chemotherapy for colon cancer can actually help people live longer and stay cancer-free longer. So participants who followed an exercise program for 3 years after their cancer diagnosis had 1/3, so like 33%, fewer recurrences and death overall than those who only received educational materials. And this is despite like chemotherapy and, treatment, surgery. So important. Not a lot of our cancer treatments have that kind of risk reduction. So this was one of the strongest studies ever done showing that benefits of exercise in cancer survivor, showing the benefits of exercise in cancer survivors because it was large, carefully controlled, and those results carry real weight for how survivorship care should be delivered. And that's why it was published in one of the top journals. So what are the actual recommendations? Well, it's important to individualize. We really need to think about our own abilities, limitations, and preferences. What motivates you to get out there? Start wherever you are and progress gradually. So at the minimum, avoid inactivity. Even light movement throughout the day helps. Limit prolonged sitting and break up sedentary time, which I know is easier said than done, especially when we have desk jobs or we just are homebodies and we really just like to sit and read or do things like that. But things that we can do could be walking the dog or gardening to stay active. But when we talk about what are the goals for physical activity, we really want to be shooting towards 150 minutes of moderate physical activity or a week, or 75 minutes of vigorous activity a week. And if we really want to achieve, if we're overachievers and we really want to get the most benefit for our effort, then we shoot for the optimal level, which is 300 minutes of moderate or 150 minutes of vigorous physical activity weekly. So what do I mean? What is moderate? What is vigorous? So moderate intensity activity is when you're breathing faster, but you can still talk, but you probably can't sing. Your heart rate is elevated, but you're comfortable. This could be brisk walking, easy cycling, water aerobics, or say doubles tennis. Vigorous intensity activity is when you're breathing hard and you can only say a few words without pausing for breath. This is kind of the more running, fast cycling, uphill hiking, singles tennis, aerobics classes, swimming laps. But the rule of thumb is that 1 minute of vigorous activity equals 2 minutes of moderate activity. Now, and that's one thing that you should be doing. So making time for kind of this cardio training, but it's also really important to do resistance training 2 to 3 times a week. And this is not just for cancer benefit. This also really helps our bone health as well. And we want to target major muscle groups. So think about what you would want to do or what you're already doing or what you would like to do for resistance training. This could be weightlifting, this could be going to a strength class, this could be going to like a Pilates or yoga, working on core balance and flexibility. Um, um, all these all these treatments have a lot of benefit for stability and reducing falls as well. So these recommendations are great on paper, but the challenge is really how to make them fit into your daily life, especially during or after treatment. Believe me, since there is such a significant benefit, I spent a lot of time in my clinic visits talking to my patients about exercise. And I'd like to invite you to chat in right now into the chat box any strategies or tips that have helped you stay active or meet these goals. Things that have made it easier, more enjoyable, or realistic. The thing to keep in mind is that everybody starts from a very different place. Most survivors can be active safely, but those with complex medical histories can start with supervised oncology-specific rehab to ensure safety and build confidence. Other practical examples might include walking with a friend, Setting reminders to move, maybe your watch tells you stand up and move. Joining a group fitness class for kind of that accountability and motivation, or using a fitness app. Really think about what motivates you. And then here's where health coaches could potentially fit in. They can do motivational interviewing, which is counseling to help individuals explore their own reasons for change and build confidence to take action. So they can help with what's called SMART goals, where you have specific, measurable, achievable, relevant, and time-bound goals that can translate that motivation into clear, realistic steps to support sustained, healthy habits. But remember two things. Small, consistent changes add up, and there is no one-size-fits-all plan. If I were chatting in my helpful resources to you, I would tell you that if you live in the Twin Cities metro, I would tell you about Survival to Strength. They are a community-based organization, and their mission is to help people who have cancer or who have had cancer become as healthy as possible through strength training and other physical activity. It's a free strength training program focused on rebuilding strength, coordination, and mobility after cancer treatment. And it's run by personal trainers who donate their time to work with cancer survivors at any fitness level. This is exactly the kind of resource that bridges the gap between knowing what the recommendations are and actually doing them. Okay, now we are switching gears to focus on nutrition, another key pillar of survivorship care. Research consistently shows that healthy plant-based eating patterns are linked to a reduced recurrence and improved overall survival. Despite this, many cancer survivors do not meet current nutrition recommendations, often due to treatment side effects, fatigue, or confusion on what's safe to eat. There's a lot of misinformation out there, and maybe they just don't understand the benefit. But again, the goal is not perfection. It's about small, sustainable shifts towards whole, minimally processed, plant-forward meals that support recovery, energy, and long-term health. Tying recommendations to the research. So this large meta-analysis combined 117 studies with more than 3 million participants looking at adherence to the Mediterranean diet and cancer outcomes. People with the highest adherence to a Mediterranean diet had significantly lower cancer mortality, so a 13% reduction overall. And among cancer survivors, a 25% lower all-cause mortality. So like reducing the risk of dying of heart disease. So improving survivorship longevity. The strongest benefits were seen for colorectal, head and neck, gastric, liver, lung, and bladder cancers. Okay, so what should I be eating? Focus on a nutrient-rich, plant-forward diet built around fruits, vegetables, legumes, so really that fiber, whole grains, nuts, and healthy oils like olive oil. There's more and more data. I'm not going to go on a deep dive into fiber, but there's more and more data about fiber and cancer risk reduction as well. So we should also include fish or poultry in moderate amounts for protein variety. And protein is so important for so many reasons as well. Limit red meat to less than 18 ounces per week. So what does that mean? That's roughly 2 to 3 palm-sized servings of red meat a week. And then really try to reduce processed meats like bacon, sausage, and deli meats, which I know you talked about during the earlier Thrive. Minimize highly processed foods and sugary beverages. I don't think I have to go into this explanation a lot, but these add calories without nutrients and then contribute to inflammation and metabolic risk. Also, try to stick with whole foods over supplements whenever possible. Nutrients from real foods are better than supplements. So now please write in any resources or tips you have found helpful for your nutrition. And while you're doing that, I want to tell you about what I would chat in. Um, I really like the Cook for Your Life website, which is a free science-based resources created by the Fred Hutchinson Cancer Center that helps survivors learn how to cook and eat for better health. It offers easy, evidence-based recipes, videos, and cooking tips, and it translates nutrition guidelines into practical, culturally inclusive, and bilingual, it has both English and Spanish, meal ideas, making healthy eating accessible and empowering for people during and after treatment. And they have this function where you can work with a chat, interact with a chatbot through text message. The chatbot's name is Ina. And sometimes I'll say, Ina, I have spinach and turkey in my fridge. Please give me a high fiber recipe. So then it takes some of that work. I can be at the grocery store and she can give me some things to buy to then complete my meal later that day. Another major recommendation we are going to talk about today is weight management, which can also play a major role in survivorship outcomes and is in the guidelines. So we know about 1 in 3 cancer survivors have a BMI in the overweight or obese category, which is linked to higher risks of recurrence, secondary cancers, and other health problems like heart disease and lower quality of life. The goal is about maintaining a healthy body weight. So I know BMI is not a perfect measure, but it's the best we have at the moment. So the guidelines recommend a BMI between 18.5 and 24.9 while preserving muscle mass and addressing psychosocial barriers like why aren't you exercising? Because you're fatigued, because your mood, because you're stress eating, like what are some of these factors or barriers that we can work around? Effective strategies include a combination of balanced nutrition, regular exercise, and behavioral modification, ideally supported by somebody like a certified oncology dietitian. But unfortunately, it's not always covered by insurance outside of other comorbidities like diabetes. For some, medications or bariatric surgery may be considered when lifestyle interventions alone aren't enough, but it's always part of a multidisciplinary supervised plan. So please write in any tips or resources that you have found that are helpful here. And while you're doing that, I will just touch base briefly on GLP-1 receptor agonists. They clearly benefit people with obesity or type 2 diabetes, improving weight, blood glucose control, and cardiovascular outcomes. And they may reduce several obesity-related cancer risks in the general population. However, we don't yet have dedicated data in cancer survivors. There's been no randomized controlled trials that have tested these drugs specifically for recurrence, survival, or late effects in cancer survivors. But stay tuned. I think that this data will be emerging soon. Lastly, what about alcohol? I find a lot of my patients drink regularly, and I don't win any fun awards when I remind them that alcohol is a known carcinogen and increases the risk of developing several cancers. But also for cancer survivors, alcohol can also worsen how you feel. It can worsen treatment-related side effects, including it can make you more tired, it can interrupt your sleep, it can worsen neuropathy, and it can worsen all of the sort of hormonal symptoms that come along with breast cancer treatment, such as hot flashes and mood changes. Or anybody who's going through any sort of perimenopause, menopause transition, alcohol just makes it all worse. So avoiding or minimizing alcohol lowers cancer risk. So if you choose to drink, keep it as low as possible. Many guidelines advise no more than one drink a day for women or two for men. But several public health bodies now emphasize that less is better, and just know there's no risk-free level. So while some people associate alcohol with relaxation or enjoyment in the short term, it generally doesn't improve quality of life, and it makes your quality of life worse in the long term because of recovery, sleep, and symptoms being worse. So bottom line, limiting or avoiding alcohol supports better energy, symptom management, and long-term health outcomes. Again, something you have control over. For those of you who have cut back on alcohol, chat on how you did it and how you felt since. Okay, now I'm going to tell you about a few more resources to help support you in the NCCN survivorship recommendations that we've talked about today. Also, now is a good time to chat in any experiences that you've had with these resources or any additional resources that you want to highlight for others. Taking Charge of Your Well-Being is an online resource by the University of Minnesota's Bakken Center that offers a holistic whole person framework covering domains like sleep, mindfulness, relationships, purpose, along with assessments, goal setting tools, and evidence-based practices for improving well-being. And I put their URL there for you to check out. Gilda's Club Minnesota has a healthy lifestyle program which offers free classes and workshops that can be in person, virtual, community based in areas like mind body practices, nutrition, expressive arts, exercise, aimed at helping people affected by cancer reduce stress and adapt healthier habits. And if you are tuning in from somewhere outside of Minnesota, Gilda's Club is part of a larger, there are chapters in many states, and it's part of a larger organization, like a national based organization called Cancer Support Network, that you can also look and see what resources are available close to you. Live Strong at the YMCA is a 12-week small group exercise and wellness program for adult cancer survivors living with, through, or beyond cancer. It meets twice weekly for 75 to 90 minutes and includes cardiovascular, strength, balance, and flexibility training. So all the good things that we need, with instructors trained in cancer survivorship and supportive care. And then in some cases, in some programs, participants receive pre and post assessments, and the program is usually offered for free or at low cost, sometimes including provisional YMCA memberships for free during the duration of the program. So check out your local YMCA and if Livestrong is offered. So I just have a few more things for you. We're starting to wrap it up. I want to tell you a few things that the NCCN doesn't recommend. The first is dietary supplements. Many cancer survivors take supplements without their healthcare team's awareness. We know this from the literature. Yet studies show no clear evidence that vitamins or dietary supplements prevent or control cancer. Nutrients are best obtained from food. Simple as that. And since supplements are not strictly regulated by the FDA, some have actually been found to contain inaccurate or harmful ingredients. So we typically recommend avoiding them, except in cases where you have a specific dietary deficiency, or if you have a specific healthcare, a specific diagnosis that warrants taking a supplementation, like osteoporosis and taking calcium and vitamin D if you can't get enough calcium in your diet. The silver lining here, though, is that this recommendation will save you money. A lot of money is spent by cancer survivors taking supplements to try to reduce the risk of cancer, when what's proven is the diet and exercise, not the supplements. The second thing is What is not recommended are very restrictive or extreme diets like detoxes, cleanses, or very low calorie plans. They're not recommended by the NCCN because they can lead to nutritional deficiencies, fatigue, and muscle loss, especially for cancer survivors recovering from treatment. These diets promise detoxification, but your liver and your kidneys already do that naturally. There's no evidence that restrictive eating speeds recovery or reduces cancer risk. Now, intermittent fasting is being actively studied, and some early research suggests it might improve metabolic health and inflammation, but there's no proven benefit for cancer recurrence or survival at this time. So instead, again, focus on a balanced, consistent eating pattern like following the Mediterranean or a plant-forward diet that provide energy, preserve your lean muscle mass, and are sustainable in the long term. And then the last comment is about sugars. So I've been doing this long enough that I've heard survivors tell me many times over the years that maybe sugar fueled their cancer. It's not true. The NCCN does not recommend avoiding sugar or carbohydrates entirely. There is no evidence that sugar directly feeds cancer cells in any way that avoiding it can stop or slow tumor growth. All cells, cancerous and healthy, use glucose for energy. So instead, the NCCN, aligned with a lot of other groups, emphasizes limiting added sugars and highly processed foods because they contribute to excess calorie intake, weight gain, and insulin resistance, factors that can increase cancer recurrence and mortality risk. So my recommendation is to focus on the things that we talked about today that are evidence-based and sustainable. And talk to your healthcare team, dietitian, or integrative medicine providers or clinical pharmacists if you want more information about the supplements that you are taking. And then here are some more reputable resources that you can look to as well. If you are looking for more data, like if, say you have a type of cancer that you want to dig into, what is the data on my specific cancer? You can look to the American Association for Cancer Research or the Breast Cancer Research Foundation if you have breast cancer. And the reason I include this is because a large survivor population is breast cancer survivors. So you can look more to specific data. So key takeaways. It is true that lifestyle changes after treatment are among the most powerful things that we can do to reduce the risk of recurrence and secondary cancers. Lengthen your lifespan. Improve your quality of life. This truly puts the power back into your hands. When you look at the numbers, the benefit of regular exercise and a healthy diet in reducing recurrence and mortality is on par with many cancer treatments. Like I said before, if lifestyle could be bottled up as a drug, it would be one of the most prescribed therapies in oncology. And it's essentially available to everybody without cost or side effect. I mean, you could argue that there is cost to exercise depending on what you do, but you know what I mean. I often tell my patients that I'm prescribing diet and exercise as part of their cancer survivorship plan, because sometimes putting it that way really changes the way that we think about it. Because these are evidence-based interventions, not just nice to have recommendations. Together, we try to set small, realistic goals to build healthy habits over time. For some, hearing this is incredibly motivating. To others, change can feel overwhelming. And this is where resources and support networks like health coaches, community programs, survivorship teams can help make changes that are sustainable and meaningful. And lastly, I want to leave you with community. If this talk sparked any ideas, motivation, something new you'd like to try, please share it in the chat now. Your insights might inspire somebody else here tonight. And thank you for being here and for investing in yourself.
Hello, everyone. My name is Tom Butina, and I am the Director of Oncology Patient Solutions and Alliances at Pfizer Oncology. Today, I'm going to be talking to you all about a platform that we've developed called This is Living with Cancer. I'm really excited to talk about this platform. I've actually been a part of it since the very beginning, about 10 years ago, so a lot of history here. And a lot of, and I hope to show a lot of the passion that I have for this platform and project, um, specifically when it comes to supporting cancer patients and their loved ones. So we'll get into a little bit more about the platform today. Obviously, this is a recording. I am unable to be, live on the call this afternoon and this evening. But look forward to fielding and addressing any questions that you might have coming out of this. And we'll be sure to get my contact info over to you all, and at the very least, help answer some questions that you may have along the way. But again, I'm really excited to talk about this platform that we have as part of Pfizer Oncology, and we'll go through a few different topics on the next couple slides. But again, I appreciate the time for allowing me to speak with you today, and looking forward to again to fielding anything that may come out of my presentation. So we can just jump right in. So This is Living with Cancer is a platform that was developed by Pfizer Oncology for anyone living with cancer. It was really important to us that we did not, make it only available to a patient who is prescribed to Pfizer medicine or have to be a part of the organization to access this content. We wanted this to be available for any and all people who have been diagnosed with cancer or who are supporting a loved one with cancer. And so this platform launched in 2017, but it goes back a few years before the launch of that platform. If you go back to the around the 2015 timeframe, Pfizer did not have a very large presence in oncology. We had some pipeline, assets that were looking promising, but at the time we had around 9 products. But what we also noticed that was missing was a form of patient support, and outside of just our therapies and the medicine that we create. And so we took about 2 years of market research and understanding, talking with cancer patients on what was needed or what was missing in the oncology space after receiving a diagnosis. And overwhelmingly, we were told that patients felt overwhelmed. Patients didn't know where to turn for accurate resources. They sometimes didn't even know how to talk to their doctor, or they didn't understand what their doctor was saying to them. And so this was very overwhelming feedback that we received, and really set us on a course to create This is Living with Cancer. And so today I'll go through some of those, some of the parts of the platform, talk about what we offer for cancer patients, and then kind of wrap us up with inviting you to check out our website and check out some of our different assets, and hopefully you can find some support and resources that you have been looking for. But first, I would like to go through kind of our 4 key pillars of the platform. So if you start all the way on the left-hand side of the slide, you'll see that we have our website and social media presence. So over the last 8 years, we've really built out our website. We have over 400 pieces of content, anything from newly diagnosed and you're having trouble understanding some of the cancer terminology that is being said to you in the doctor's office, all the way to survivorship and inspiration, and how to infuse some of that inspiration into your day-to-day activities as you navigate survivorship, and everything in between. I would say that our bread and butter as a platform is our quality of life resources. So addressing mental health challenges, addressing physical and emotional well-being. So nutrition, exercise, making connections. Those are the types of resources that you'll find on This is Living with Cancer. To be clear, we did develop this as Pfizer, but we are not tied to any specific drug. I had mentioned that you didn't need to be prescribed a medication to access this content. We go as far as not even talking about medication on this platform. So we really want to stay true to our original mission of being there to offer patients where they felt there was an unmet need in types of resources coming with a cancer diagnosis. We have our Living With app. which I will get to later on in this presentation. But the Living With app is really a way for patients to, they can download the app, but really create that sense of community. So think about it as like Facebook kind of meets Caring Bridge, but keeping everything kind of private. You don't have to tell the world about what might be going on in your life. So as a patient, you can invite who you want to be in your circle of support. And so it keeps it a very intimate process. And again, you don't have to feel like you're telling everybody on social media about your day-to-day challenges, or even we've had patients say like they don't want to put out there that they've had a really good appointment. They just want to keep it really kind of close knit with their group, and this app allows you to do that. Because we've grown so much over the last 10 years, we have a lot of content, and so we offer a way for you to personalize it. So if you are diagnosed with prostate cancer and are really interested in nutrition and exercise, there's a way for you to filter that. And so our website infuses some AI technology to kind of help bring all of those resources together for you and what you're looking for, so you don't have to go searching around for everything. And then our partnerships. Every time I present on This is Living with Cancer, I love to save this part for last, because partnerships are truly the lifeblood of our platform. We partner with over 81 advocacy organizations, all the way from your National American Cancer Society partners, all the way down to your super regional and very tumor specific partnerships. And really, what this does is gives our mission and our platform the credibility that we work with these credible and amazing advocacy groups. We co-develop content together, and it is really a great synergy to have working within the advocacy space. And again, if a patient were to land on our website and see, wow, they did this awesome prostate video series with Zero Prostate Foundation, again, that just adds that level of trust for patients to know that what they're viewing is a credible asset, and they can trust the content that is being developed. And so partnerships really add to that layer of our platform and getting information to cancer patients. As we kind of evolve, the kind of the program itself has shifted a bit, where we wanted to kind of fill those unmet needs at the very beginning. We feel like we did that, but now as things shift in our world these days, there is constant needs that are being unmet, right? There's always something that pops up that is new, and we pride ourselves on staying on top of those different topics, right? When it could be navigating health insurance. It could be navigating different topics. Biomarker testing and genetic testing has gotten a lot of attention lately, and we want to make sure that we're, staying on top of that type of content. So we're always striving to provide content for relevant topics that are happening in our world today. We are grounded in science. Everything that we do is obviously fact checked and done the due diligence, but it's important to us that the information that we're providing is coming from a credible and trustworthy space. So everything that you see, we take kind of that really hard to understand, published papers and whatnot that are coming out, and try to make it as patient friendly as we can, so that people don't feel from in a way that they're not able to understand some of the advancements that are happening, or some of the topics that are happening. So equity is always on the table for us, so making sure that we provide an equitable experience for our content. I talked a little bit about personalized content, and then our round this out a little bit is that key focus on the whole health kind of journey for patients, and making sure that we're providing content that is not only going to help with a specific tumor type, but also some of those areas that maybe you're not getting from your care team. And so really diving into mental health and some of those various topics that may not be talked about a lot. Just to focus a little bit more on the resources that we offer as part of This is Living with Cancer. I talked a lot about advocacy. About 50% of the content that we do on This Is Living With comes from advocates and our advocacy network. So again, pulling in the experts. We don't want to recreate the wheel. We want to work with those organizations that are producing great content. Our focus on nutrition, exercise, and wellness, again, that's like our bread and butter. That's what we've really done well over the last couple of years and have partnered really closely with a lot of organizations that, again, they are the experts in this. We recently launched a partnership with Memorial Sloan Kettering, MSK, uh, to develop a series of wellness content and put it on This Is Living with Cancer. So again, working with large advocacy groups and obviously large cancer centers to develop content for patients. I talked a lot about personalized support. So again, whether you're a patient or a caregiver, we think that there's something that you could find valuable as part of our platform. And there's a way to find it easily by filtering and different aspects of technology that we've infused into the platform. And then inspiration. When we launched our platform, we worked with 19 different cancer patients, real people. We don't do paid actors here. These are real cancer patients. And to even kind of hammer home that this is for anyone, most of the cancer patients that we worked with at the beginning were on competitive products. So this was a truly a way for us to showcase true real people who are living with cancer. Um, and we got a resounding feedback from this that patients love to see someone who might look like them, might be in the same stage of life as them. We had, Lindsay, one of our patients on the platform at the time, was 33, had two small children, and was dealing with a pretty serious diagnosis. And then we had, on the flip side, we had an older gentleman who is, going through a pretty advanced prostate cancer diagnosis, and everywhere in between, every walk of life. And it was important to showcase the diversity and really, again, pull through that equity lens that made patients feel like they were represented. To just touch a little bit more on the app before I kind of round out this conversation. So I talked about kind of creating your circle of support, but the app is much more than that. The app really was developed to kind of manage your day-to-day life with cancer. And so there's ways that, obviously like you can take notes at a doctor's appointment. There's ways to keep that. There's areas if you want to upload your insurance card and keep it on the app for future appointments, you can do that. But I think where the real benefit and key kind of part of this app is the support section and the health section. So the support section is where, as you build your circle of support, friends, family, whoever you'd want to invite on the app, you can actually go in there and you can actually request support. So let's say I've just went through chemo. I'm just so fatigued and exhausted. I can't even get myself to, make myself a meal. In the app, I can request anyone available to come over and make lunch or help me with dinner, and it will be sent out to everyone who is in part of my circle and support. And someone can be like, yeah, hey Tom, I can come over tonight and help you with that. And we have seen and heard that patients absolutely love this aspect of it because it allows them to send it without having to do a text. A lot of times we've heard that, patients don't always want to have to like text somebody. They feel bad. They feel like they're a burden. This way you can just send out a kind of a mass request and whoever's available can pick it up. In the health section, this is a really cool advancement that we've had where you can start to track some of your health, track like different aspects of your health. So let's say it's your mood or your fatigue levels or your pain level. You can track that daily in the app, hit a button, and it will send a report to your HCP. And so if you go to a doctor, let's say your doctor's appointments are 2 or 3 months spaced out, and your doctor asks, well, how has your pain level been? Or how has your fatigue level been? It's really hard to remember that in the moment, but you can create reports and you can show them a chart every single day over those 3 months of how you were feeling. So it's a really intricate kind of app. And so this is something that we continue to push part of our platform. And I think if you combine the app experience with our robust website, there is a lot of great content and a lot of applicability to cancer patients and their loved ones. And with that, I know that I was tight on time. to begin with. So I want to just pause right there. There's a QR code for both our website and to download the app. And I'm, again, very grateful for the time today. I apologize again that I could not be there live. But any and all questions, please send to me, and we'll facilitate that. Um, and again, anything that you need answered. So thank you so much for the time. I really appreciate it, and I hope you have a great evening.
I just wanted to thank everyone for joining us for the 2025 Thrive series, and thank you to our presenters this evening, Dr. Tara Rick and Tom Butina, and really all our presenters throughout the whole series. Everyone will receive an email shortly with a quick survey to help us to continually improve our programs. After completing it, you can enter to win a swag bag from the Masonic Cancer Center. And if you have any questions about this evening's presentations or any of our survivorship program, please email us at survivorship@umn.edu. We are excited to bring back some of our programs for next year again, and we look forward to seeing you in 2026 for Bloom, our breast cancer survivorship program, our survivorship conference in April, and then our survivorship picnic in summer. So we will see you all next year. Have a wonderful evening, and thank you for joining us.